I first became aware that something was wrong during my pregnancy when I noticed I had all of this swelling. So on my hands particularly, I couldn't get my, rings on my hands. My feet started swelling, and then I noticed in my actual face that I kind of started to feel and look like a bit of a different person.
At 36 weeks pregnant, Amelia Thompson was diagnosed with pre-eclampsia.
So pre-eclampsia is where you get high blood pressure in pregnancy and multi-organ dysfunction. And we think the cause of it is probably from the placenta. So there's still research into it because we're not exactly certain what it is.
Dr. Sue Wei Lee treats women with what can potentially be a life-threatening condition, elevated blood pressure that affects the mother and unborn baby.
As obstetricians, we get quite freaked out about preeclampsia because if you think about the name of preeclampsia, it's pre-eclampsia. And eclampsia is where a patient can go on to have fits, and fitting, of course, can be catastrophic.
Pre-eclampsia can have a myriad of effects, from kidney dysfunction and swelling of hands, feet and face to headaches and vision issues. But the first red flag is high blood pressure.
Then the next thing we find is there's often protein in the urine because their kidneys become leaky. The liver function then goes off. And in the worst case, your platelets also become really low.
As soon as we found out that I had it, we basically booked in for a cesarean for the next day. So it was very quick. So there was no treatment. It was, let's get him out as soon as possible.
If the cause of preeclampsia is from the placenta, then essentially the only definitive treatment is to deliver the placenta. But we can't deliver the placenta without delivering the baby. So it depends very much on what gestation we diagnose it. We kind of then have to weigh up that balance between, do we deliver a preterm baby against the risk of the disease to the mother? So we then treat the blood pressure and then see what else we can do. So it's a fine line that we walk there.
It was thought that once the baby was delivered, the risk to the mother was over. However, new research has proved otherwise.
And we'll check your blood pressure, if that's okay.
Yeah. So we see women at 3 months after they've had a baby. And historically, we used to think your blood pressure comes back down to normal. But when we then also look at the other cardiovascular risk factors, so high cholesterol and diabetes, we're actually finding more women with undiagnosed high cholesterol and other risk factors. So that's been a surprise, both to us and to the patients, because, these are patients that are generally young and fit, and they think, I'm healthy. I've done all the right things. I'm not particularly overweight, and you look at it and go, how did it get there?
The link between pre-eclampsia and heart disease forms the basis of the Enrich Me study set up by Dr. Lee, where women have their cardiovascular risk assessed after their baby is born.
We really want to raise awareness that pre-eclampsia and a pregnancy complication increases your long-term risk of getting cardiovascular disease. And this study will give us some tools and give the patient some tools as to how you manage your risk, how you reduce the risk, and keep you healthy for longer.